So, Dory, do you want to just start with how we talked about getting perspective on harm reduction?
Sure. The one thing that we need to truly remember is that we're asking people to change. We're asking people to change something that they've been doing for a long time. This isn't something that happened overnight. So just real quickly, by a show of hands, how many of us have tried to eat healthier? Okay, keep those hands up. How many of us have tried to maybe incorporate an exercise program? Smaller, on a smaller scale, how many of us have tried now and then that you smoke, have tried to quit smoking? Okay, that's doing good. Any change that we make from little things, even like nail biting, okay, is difficult. It's human behavior, okay? So, for another show of hands, how many of us have succeeded with those New Year's resolutions, we'll call them? Oh, better than I thought. Okay, if change were easy, I would weigh 120 pounds. Okay, I've stopped drinking soda and tried to drink water. That doesn't last too long. I've gone with your salad, look wonderful. Okay, but you know, the cheeseburger just was so much more tempting. We tried to cut down on sugar. Okay, maybe I'll stop eating sugar when I become a diabetic. Same thing. Do I stop drugs before or after I become an addict? Am I able to stop? With our population, most of the time the answer is no, I can't. It's not that I might not want to. I've had that thought as I reach for that second chocolate chip cookie. Oh, you know, maybe I shouldn't finish the package. Harm reduction is 4 cookies instead of 4 bags of cookies. Okay, if you want to think of it in very simple terms. Change is not easy for any of us. And we're all what I would consider like mainstream population. We think differently, we process differently. We even hear things differently, how we interpret what is said to us, how things are said to us. And that is key with harm reduction. How we speak and how we present information could very well make a difference between whether somebody is going to even think about stopping what they're doing. Because if I have somebody yelling at me about what I'm eating, you know what, I'm eating that whole bag of cookies. Okay, because now I'm angry and I'm upset. And as an addict, I'm already feeling worthless. I've already lost probably most of anything I've ever had, whether it's my home, whether it's my family, my job, my license, a bank account, my dignity, my self-respect. So how we talk is very important because we're starting at the bottom and we're going to try to build them up to eventually wanting recovery. So where do you start? It's hard to talk to people who are already intoxicated or high. Don't even try. Why did you go out why did you just go out for 2 days and go get drunk? Now you're still drunk. Okay, that conversation is not going to happen and it's definitely not going to go well. Kristen and I were talking about when somebody walks in about just make sure they're safe. Do we restart medication? Do you want a bottle of water? Have you eaten in the last 2 days that you've been running the streets? It's extremely difficult and it requires a tremendous amount of patience on your part. I spent 10 years as a supervisor at our MICA residence with Mr. Hervé over here. And I've actually spoken with several of you in regard to addiction and addictive behavior. 10 years in resident, I'll give you all credit just for working residential. Working residential and dealing with substance use is an entirely different beast. So there were days where Hervé and I didn't know whether to yell, scream, cry, choke each other, but you know what? It's how you present yourself. We've had some successes and we've had some failures. We've had deaths, we've had overdoses. And that's the reality. If you don't stop, eventually, the end is, as we've always heard, in death, institutions, or jail. It does not end well. If I don't stop eating the cookies, the end result will probably be diabetes. Okay, if we don't stop smoking, the end result may be lung cancer. Okay, but change is not easy. And when you're talking about addiction, you've already caused damage to your brain. The brain does not function the way it should. The messages up here, it's a mess, it's a committee, it's, you know, there's voices going back and forth, and now you have mental illness on top of it, and medications that now may or may not be working. Because once you start taking the drug, medications don't work. So sometimes when we question, wow, why did you do that? The answer is, I don't know. So,
And I think that was really important because I think we have to, I mean, I'm a smoker. Okay, and I will admit fully that if I don't get my nicotine when I want it,
somewhere.
I am very, very panicked if I don't have my storage of what I need, because I'm not there yet. So my husband telling me, you need to stop smoking, just stop. That doesn't work, because that's, for me, first of all, it probably affects me at this point chemically, right? It probably also serves some coping mechanism that I've learned over time, many, many years. And I'm not ready to say that lung cancer is more of a concern than me getting my next cigarette. So we're just trying to bring it so that it's something we can all relate to. And what I wanted to do, this is just a quick little blurb, but back in the day, abstinence was where you needed to go. I mean, I started working with the MICA population, or those who are chemically addicted and have serious mental illness, back in the late 90s. And the goal was immediate and complete abstinence-based lifestyle. You go to a therapeutic community for 6 months, you come to a CR, and we didn't take people in community residences, and I know you community residence folks can understand where I'm coming from on this one. We didn't take someone unless they had 6 months clean into a community residence. Do you see that now? Oh, no.
Our houses would be empty at that point.
You don't see this. But that was the message. And what we saw was only maybe 3% of this very complex population having long-term success. The philosophy now, which is evidence-based, which means that it's proven that it works, is harm reduction and minimizing injury to self, others, and the community. And that doesn't mean that the goal isn't eventually working towards, hopefully, sobriety. It means, what do we do now, today, for that individual who can't stop using? Hold on. Which one?
Yeah.
There we go. Nope, that didn't do it. Hold on. Please hold. There we go. Thank you. You might have to come back. So basically what this is harm reduction, and we're just going to go over some principles and practices of it. What'd you do? You did the rolling thing? The rolling thing. It went the wrong way. Okay. So we wanted to just give a very brief definition of what harm is. And harm is simply anything that happens, no matter what causes it, that damages any part of you, your life, or those around you. Harm can be physical, emotional, social, and some would say spiritual. And this is written by someone who is a harm reduction psychotherapist. And I think this is really important to understand what the word harm means. Simply anything that happens, no matter what causes it, that damages any part of your life or those around you. So what is harm reduction? Harm reduction is an approach that promotes health in a way that, and I underline this, meets people where they are at. And accepting that not everyone's ready or capable of stopping their substance use at just any time, especially any time we want them to. And that comes from the Recovery Research Institute. But you're going to hear this phrase a few times throughout the presentation, meeting people where they are at. Want to ask something?
No.
I'll realize which way I'm going. So the goals of harm reduction, very quite simple, although it might seem quite astronomical, because a lot of people have mixed feelings, especially when you've been in the field for a very, very long time, about what the goal really is of harm reduction. But some people think, oh, well, it gives people, carte blanche to just use and destroy their lives. That's not really what it's about. It's about improving the health and well-being of the individuals, their partners, their families, their associates, and their communities. It's not just about the individual, but it has to start with the individual. And if you see the little thing, the little picture, says harm reduction saved my life.
It's really about making better choices. Okay, the choice might not be to completely put the substance down at that moment, but what choices can you make, small ones, that are going to improve your life? Like being out at 3 a.m. in the morning, looking for trouble. Okay. We joke, nothing good happens after midnight. Okay. And
I will say 10. I don't think I do. Well, yeah.
listen, I'm down to about 9 now. Okay. But even, when we think about ourselves, think about some of the things that you did, maybe with your friends as we were all growing up. I'm sitting here going, wow, I'm lucky to be alive. Okay, because 110 on the back of a motorcycle with no helmet is really not harm reduction. Okay, no, not safe at all. And when I think back, I'm just like, what was I thinking? Oh yeah, that's right, I wasn't. That was right. Yeah, okay. Spur of the moment, sure, yeah, that sounds like a good idea. But I was 19 years old, and we don't think right then. We're lucky we think right now. Okay. So it's just making those little tiny baby steps to get to the ultimate goal of abstinence, which may include some type of a medication. It's not a bad thing. When you mentioned the therapeutic community and then coming into a community residence or going back home, I worked at Daytop for a while. And the whole TC approach, when I started working there, was almost frightening, because I was balancing working in a therapeutic community as well as working in OMH. I'm like, oh my God, this is abusive. Am I ever even going to be able to work here? People are screaming at each other. People are cleaning corners with toothbrushes, doing the bathrooms. Sit down, you sit over there. No, you get up and leave because you made a comment that was, unnecessary. It was awful. In my eyes, I kept my mouth shut, okay, because here I was being exposed to a different type of approach, which is the approach that we're trying to talk about as far as complete abstinence and harm reduction. there's a long way to go between where they're at.
Yep.
And where they need to go. So basically what we're gonna do is we're gonna do the best that we can to try to hold their hands and make them feel like, you know what, I do care. Somebody cares about you until you can care about yourself.
The therapeutic communities back in the day were not meeting the individuals where they were at. They were making them meet the program where they were at. And that's where, you know, some of them were mandated, some were coming directly out of institutions, it was a very difficult group. And many had co-occurring, whether it's intellectual disability or serious mental illness, co-occurring disorders. So certainly when you have that trifecta going on, you're not meeting someone where they're at, you're forcing them to do something they're not able or capable of doing, particularly in that moment. So one of the goals of harm reduction really is, this is number one, as far as I'm concerned, and I think Doreen might say the same thing, is reducing mortality. And we just wanted to give you some updated information about mortality. So due to disease and accidental overdose, many of people with substance use disorders die. So we want to lessen that and provide access to medical care. And with some data that we found from 2021, it was the most updated information we had, showed the number of alcohol-induced deaths. Now we're talking about alcohol, something that's legal. Induced deaths have continued to increase to more than 52,000 people, which is up 43% from pre-pandemic levels. Okay. And more than 107,600 Americans died from drug overdose in 2021, which is the highest annual death rate as per the Centers for Disease Control and Prevention. The CDC has an enormous amount of data of analysis that they do. And to me, this is extremely scary. And I know you guys are all hearing about the opioid crisis, and that is largely where this number is coming from. But this information, this is just about overdoses and people dying from, alcoholism. This doesn't include those individuals who have co-occurring medical disorders from their drug use, such as hepatitis C or HIV. So those numbers don't even include that. And obviously, because, one of the things, and we'll move along through the slides because I definitely want you to watch this video at the end, which I think is very important. A lot of the individuals that are interviewed by this person, Malcolm Lewis on YouTube, who does a lot of his interviews from what I consider a harm reduction model, with individuals that live in Kensington, Pennsylvania. Or Philadelphia. Do any of you know about Kensington? Okay, it is considered to be the largest open air market in the world. Open air drug market. So what does that look like? That looks like people shooting up, passing out, living on the streets in tents or not. And with abscesses on their arms, on their legs, and you ask them, why aren't you going to the hospital? They're like, well, I thought about it and I did go there, but then I left. And one of the biggest reasons they leave is because they have to wait a long time in the emergency room. It's not that they don't want the medical care, but they're not given anything to help with, unfortunately, going through withdrawal. So why would I want to go to the hospital if I can't get my next fix when I need it? And it's not about getting high anymore. What it is now is about staying well. I don't know if you hear that term, but that means just so you don't have the withdrawal. Many people say they don't even get high. So that speaks volumes.
Because the withdrawal from opiates is awful. It's painful, physically painful. I think we've all seen like either a movie or a video or spoken to somebody who wants to go through that voluntarily. So without some type of medication and support, it's not gonna happen. And then they stay on the street. Those videos that we looked at, they were so powerful. And you have people on the street trying to resuscitate each other. The one individual,
Yeah,
the man
our
was
man.
obviously had already passed. Well, so the other gentleman, man, who was obviously high, is trying to perform CPR and provide Narcan. It was sad. People standing, they look like they're gonna fall over. Like, and they just look old and weather beaten and just, they're lost souls. So, our job is, if you just reach out a hand to one person, there's what, 30 people in the room? We've just helped 30 people. So, and it's one at a time.
So going back to the goals of harm reduction, it's about getting treatment for the drug dependence. So it's about inpatient and outpatient detox. It's also about methadone, and you're gonna have to say this word for say it again.
Buprenorphine.
Okay. Which are considered medication-assisted treatment. A lot of programs that we're starting now that we're doing RFPs for to bring into our organization, especially now that we have our OASIS licensing, our certification, are all about medication-assisted treatment. Gone are the days of complete abstinence. Back in the day, it was like methadone. You can't be on methadone and come to this program. You want to have, there's no if someone has to take medication like metformin for diabetes, right? Why do we have a stigma about someone taking methadone in order to stay off of lethal drugs and have a quality of life, right? Of course, this speaks volumes to us, sober living and transitional housing. And it's also about empowering the communities and reducing stigma, because the bottom line is if we can change public health policy to really destigmatize addiction, then we can empower our communities to help the individuals that suffer through these other options.
And we all know probably, and I'm assuming that each one of us knows somebody that currently has an issue with substances, and that's including alcohol, because alcohol can be absolutely brutal and it destroys people just as much as heroin or opiates or anything else. Or a friend, it's so rampant. So, do each of you know someone, like, is there somebody that comes to mind when you start talking about addiction and alcohol abuse? There's somebody that comes to mind going, that
And
person
sometimes it
need
might
some
even
help.
be ourselves. Stuff to take a heavy look at. We wanted to also introduce examples of harm reduction. And we started off with some very basic things that we can all relate to. Eating a reduced fat or low carb chocolate bar.
There you go, there's my chocolate.
Wearing a seatbelt is considered harm reduction.
Should have had a helmet on when I was doing 110. Yes.
Back in the day.
Yeah,
Washing your hands, right? Especially when we were going through the really, really terrible days of the pandemic. But we're going to move down a bit to harm reduction amongst those who use. Exchanging used syringes for clean syringes. Implementing methadone and buprenorphine programs. Having Narcan available and teaching overdose prevention. And as you guys know, and for those of you, I haven't sent it out to everybody yet, but I have arranged a Narcan training for October 31st to Nassau County. She's going to be coming in, and she's also going to be doing some substance abuse training as well. So I have sent it out to the clinical team, and I will be sending it out to the greater residential teams as well. I just have to get numbers. That's why I'm doing it in stages. And basically advocating for the rights of drug users. That doesn't mean, let me just qualify that you're advocating like, yeah, let's let everybody, run rampant with fentanyl, which it has taken over heroin. Heroin doesn't exist anymore. Actually, heroin is safer than fentanyl at this point, because they also mix the fentanyl with animal tranquilizer. It's called tranq. That's what they call it. And that's where the abscesses come from all the fillers they put in. But what that means, advocating for the rights of drug users, that's more about medication-assisted treatment, meeting them where they're at, taking it one step at a time with them, advocating for what they need, not forcing them to make the change. And so I'm just going to see which one is that. Okay, went the wrong way. So what does harm reduction look like? Can you identify harm reduction when you see it? So we have some visuals for you. Okay. So we have the woman wearing the mask. She looks like a nurse. We know the mask days. Eye protection being worn in certain areas. That yellow, you might not be able to see what it is, but what that is a disposal unit for needles. So some communities have those disposal units. Minimizing risk can be seen as washing your hands. The helmet was supposed to be a bicycle, but same idea. You can go with that.
Yeah.
But the same thing on when you're in war. That's an old style helmet, but it works. The corner picture, this one, is actually a needle exchange program. Wearing a seatbelt, the no smoking signs. And this is also reducing harm because you're reading labels, right? And seeing what's healthy for us, what's not healthy for us. If I have to count carbs, if I have to watch my sugar. Make sense? Okay. Okay. So there's principles of harm reduction. By reducing the daily harm that one experiences, individuals can be empowered to make greater changes in their lives. So this part Doreen and I really keyed in on, because and I'm going to read it. Harm reduction recognizes the realities of poverty, racism, classism, sexism, social isolation, trauma, and other inequalities that affect vulnerability to and a capacity for effectively dealing with drug-related harm. What that really means in a nutshell is that there's all these risk factors, whether they're social risk factors, parental family risk factors, environmental risk factors, trauma risk factors, your own genetics, all play a part in the vulnerability to and capacity for effectively dealing with drug-related harm. All those things come together. So how can we practice harm reduction? So, like I said, we were going to say this again, meet people where they are at physically, geographically, mentally, and emotionally. That's probably the most important one. Meeting them, when we say meeting where they're at, definitely physically and geographically, but mentally and emotionally. And during the course of their drug use and or recovery. But what harm reduction involves is, and this is really important, non-judgmental, non-coercive provision of services. In other words, not making and this is a tough one, I know, trust me, I've been doing what you guys do, making someone go to rehab. Lots of times our folks end up in the criminal justice system, right? And what is one time, sometimes they're forced to go to treatment. It's a catch-22, that could be helpful, but if they're not ready, it's not going to be so helpful. Low threshold programs. What low threshold programs are those programs, treatment programs that, excuse me, don't place high demand on the individuals. So they're meeting the individuals where they're at. They're not putting a lot of heavy demands on them, especially when they first come in. Okay, we're here for you. When you're ready, you come to group. Okay, you don't feel like attending group today, that's fine. Maybe we can meet later. And allocating resources to people who use drugs. What that means, again, is not providing them with their drugs, but giving them resources such as, you want to talk, here's my number. Do you need to know about a needle exchange program? Do you need to know about a location that can set you up with case management? Or who can provide you with other forms of help, such as clothing, meeting their basic needs?
Just.
Oh, go ahead.
No,
Go
just
back.
real quickly, one of the things where we were talking about non-judgmental, non-calls and provisional services. If you can, your job is when you're speaking with somebody, you got to get them to trust you. If they don't trust you, they're not going to open up to you. They're not going to come back and have that conversation when you say, okay, you know what, if you like talking later on, come back, I'm here. It may take them weeks to come back to speak to you. They're not going to come back that same day. So how you present yourself and how open you are is going to make the difference to whether or not they're actually going to speak to you about how they're feeling, how they're thinking. And you're not going to, and it does get disappointing sometimes because you spend an hour and a half, or however long, having this in-depth conversation about their substance use and how they're feeling terrible and all the negative things that have happened in their life. And 2 hours later, they're out getting high again. The next time they come to you and they want to talk, you might want to just say, well, that was an hour and a half of my wasted day. I don't want to talk to you again. Obviously, you weren't listening. It's a conversation that you have to have over and over. And when we did groups at Daytop, you're talking mainstream population, maybe 50. For every person in the room, for every 10 people in the room, one may enter into like a full recovery. Statistically, the numbers are extremely poor and more people die than recover. So if you have to have that conversation 50 times before they say, oh, yeah, you know what, can I have your phone number? Or maybe tomorrow, can we talk again? We need to be there because it is a process. It's not something that happens overnight. And it can be a very painful, disappointing process because we want what's best for them. We really do. We want to see people get help. We want to see them recover. We want to see them have a better life. But you're talking about people who have lost their homes, lost their license, have no family, probably have some type of an illness, feeling physically ill. When they wake up in the morning and they don't have that drink or that drug, it's a miserable day. It physically takes its toll. And with physical pain comes emotional pain, comes mental pain. So it's not easy dealing with addicts. We are not talking about occasional users most of the time in our population and our setting. We are talking about people who are addicted. It's not just something that they do for social recreation. They don't have 2 glasses of wine with dinner on Saturday night. It's just, that non-judgmental and that trust and that open communication is so important. That goes a really, really long way. So, you know what, even if they just remember one little thing that you said, maybe somebody else will say something else down the line, and all of those little pieces eventually will come together.
So I'm glad actually Doreen brought us back to this, because one of the areas in order to how we can practice harm reduction is through motivational interviewing. And we're not going to go through the whole process of motivational interviewing. We're just going to give you a little snapshot to give you a couple tools for your toolbox. Because learning motivational interviewing is a process. But motivational interviewing is a counseling approach designed to help people find the motivation to make a positive change. It's a client-centered approach, particularly effective for people who have mixed feelings about changing their behavior.
I was just gonna say, you need to help them find their why. Why do I want change?
Yeah,
And that-
no,
and
and
that's a
that's
big
the
one.
whole point, because there's all different stages, and one of the very, very, very early stages is pre-contemplation. You know, we know what contemplation is, right? You know, maybe I'll do this today, or maybe I'll do it tomorrow. I'm not sure, but pre-contemplation is even before you get to that point. And that's a stage of change. That's actually, you know, for some of our folks, many of our folks, that's where they are. And that's where we have to understand where they are and work within that environment through engaging them. You know, working in the staff office and them upstairs in their room and not seeing them for 8 hours isn't gonna be, that's not providing them with engagement, right? We want to make sure that throughout, because you know, they might be having a day where they just want to be left alone, which is fine. But that little knock on the door, like, hey, how are you? What's going on? You need anything? Those are important things. Engaging them, not taking things personally when they don't want to talk with you, but at least knowing that you're there. They have to go. Okay. So we wanted to just give you a couple areas where you could, you know, utilize for your process of engagement. So asking open-ended questions like, can you tell me more about that? If they start talking to you about something, or how would you like things to be different? Open-ended. Don't give them the answers. And affirmations. You know, statements of recognizing what their strengths are, talking about what their strengths are, because like Dorian was saying, they very often don't know that they have any strengths, or they've forgotten what those strengths are. And paraphrasing and exploring meaning throughout what they're speaking about. And emphasizing emotional reflection, recognizing that they may be expressing things that are very hard, you know, very painful, and validating how they feel, not minimizing it, not saying you're going to be okay, you got this, you're fine. No, recognizing you're hurting, but also empowering the individual, providing them encouragement, identifying what that person's strengths are and the progress that they make, even if it's a baby step process. Okay, you didn't, you know, you slept to 2 today, but yesterday, but today you got up at 12. That's huge. That's big progress. And this one we really wanted to make sure we put in, reminding them that they matter, reminding them that they're not just another client living in your house or that you're supporting, that they, John, whoever they are, that they're a person and that they matter, because they don't really think they do. Ooh, sorry. Ooh, okay, so we wanted to just also put in some myths regarding what harm reduction is. So these are some big ones. Harm reduction encourages people to use substances. I'm sure many people in this room, prior to kind of learning about, and I encourage you guys to Google a lot of this information, believe, well, harm reduction is saying that, you know, it's okay to use drugs. Nobody's saying that. What it's saying is that harm reduction activities don't encourage substance use. They encourage people who use substances to start treatment. So by using a harm reduction model, starting the engagement, starting the dialogue, the person starts to think about, might not, like Doreen said, it might not happen for weeks, but starts to think about, okay, maybe I'll give it a try. Maybe I'm sick and tired of being sick and tired. It helps them start to think about it. Another myth is abstinence-based treatment program models are not supported in harm reduction, which is false. They are. They are, but we need to get the individual to that point, right? We have to reduce the level of harm so that they can make that decision for sobriety. So they're actually very much supported, and the approaches serve as a bridge to treatment or cessation of drug use. And harm reduction can also address a range of issues that support the persons to be in better health and shape if and when they can decide to access treatment, which can optimize the chances of folks reaching their recovery goals. So harm reduction also has the added effect of attaining medical treatment, of taking care of themselves, starting to take a look at medical conditions they may have been ignoring, like the abscesses on their arms. Maybe saying, okay, Doreen, I know that you're going to have a difficult time, but you've got a big giant abscess that I'm worried about, and I know you're going to struggle when you're at the hospital. I'm going to go with you to make sure I advocate for what you need, whether it's medication assistance treatment, to get you through so that you can get the treatment you need. I'm not telling her to stop using it. I'm telling her I'm going to help her get what she needs.
And I have sat in the hospitals with individuals who don't have family to support them. Just think about it. We have family, we have people who care. If something happens to us, we have people to talk to. We go in the hospital, we have people that are going to visit us. And a lot of them don't have that. That's where you come in. Okay, because we're there to help the people we support. And spending 2 days in a hospital with somebody because they were, all right, smoking crack,
Yes.
fell off the curb and then got hit by a car. Okay, yeah. And honestly, we really weren't sure she was gonna make it. Lo and behold, though.
She made it.
But yeah, by the grace of God, the universe, or whatever the belief is, she did make it. But maybe if you had come home that night, instead of, panhandling, maybe there would have been a different outcome. But it does take a lot, and it requires a lot from each one of you, because believe me, I did not want to sleep in a recliner for 2 nights. Okay, and then I get up and I'm like, oh, now I need the hospital. Okay, but that's not going to be the case all the time. But you putting out that hand each time that they fall down and try to pick them back up, they're gonna learn to trust you eventually. And eventually they might listen. We all have a lot to lose if all of a sudden, we're out there drinking or drugging or whatever it is. We have our jobs, we do have some self-respect. Okay, each one of you do an amazing job. Okay, so we have value. We feel that we, bring something to the table. We have some feeling of worth. Our individuals, they don't have that. They don't have licenses. If I go out and have a binge, I could lose my license. Well, I'm not going to do that. I could lose my family. I could lose my job. I could lose all the whatever little money I have saved. They don't. So reminding them of a loss. For us, a loss, we're like, oh, wow, I don't want that to happen. So you know what? I'm not going to do that. Well, if I don't have anything, what does it matter? So why am I going to get clean and sober? What am I going to benefit from? And that's where you need to start.
Another myth is that harm reduction drains resources from healthcare and treatment services. And actually, it's quite the opposite. Harm reduction tools and services are relatively inexpensive and cost effective. They increase social and financial efficiency by reducing the transmission of infectious diseases at a lower cost, rather than waiting to treat complications of advanced illness at a much higher cost. So like we were talking about before, the individuals that unfortunately allow the medical conditions because of the fear of going to the hospital. And quite frankly, some hospitals are not always kind to individuals who have substance use disorder or alcoholism. They're just not. Because, you know, they feel they have more important individuals to support. Getting them getting in early, you can deal with a medical condition right away. But then next thing you know, when they're in the throes of hepatitis C that has damaged their liver, and now they're hooked up to machines and living in the hospital or going to a rehab, that's high cost. Harm reduction approaches lead to safer use, moderation, or abstinence, depending on the individual's desires and needs. Because the focus is on improving the quality of life. Any step that reduces harm to individuals, their loved ones, their communities, and society is embraced and celebrated. So we really want to send home any positive change is important. This we found from a book called The Unbroken Brain, and it might be something you want to look into and read it. It's supposed to be a very good book. When people start to be valued by others, they start to value themselves. And even when drug use remains unchanged, harm reduction nearly always increases the amount of warm social contact that most traumatized and marginalized people have. Because this is essential to coping with trauma, it provides a foundation for human growth. Harm reduction is the opposite of tough love. It is the unconditional kindness and imbues what looks to outsiders like irredeemable ugliness with startling moments of transcendent beauty. Kindness, unconditional kindness. Now let me not play it yet. Okay. This is a video that I wanted you to see. Darlene lives in Kensington, Philadelphia. And she's interviewed by this gentleman, Malcolm Lewis. And he does a lot of man on the street interviews. And he really is connected to a lot of the folks in the Kensington area. On YouTube, it's AML, if you're interested in seeing some of his videos. But I thought that Darlene was a good example. She has other videos where she's not doing so well. Now, this is kind of a snapshot of some questions that Malcolm asks, Darlene's responses, Darlene's life right now, that I think is important for us to look at and kind of embodies what harm reduction really is about. I think I'm just supposed to.
Let me see, mic check. Say mic check.
Mic check.
Okay, cool, I can hear you. Hey, what's up, AML family? I'm back out here with a day one, Darlene. You know, she is an AML film pioneer. She was there from the beginning, and we have, came a long way. And I don't forget about my people who helped me get to this point. I will always, have their back. It's hard to keep track of them because of the phone situation, so I have to run into them. But you know who it is. It's your girl, Darlene.
Hey, y'all. What's up? Here today, I ran into my old time buddy, Mal, and so happy I got to see him. It's been a little while, a couple months. But I just wanted to update, let Mal know and everybody know that I'm actually doing pretty good. I'm actually trying to get my, goals and everything together. I'm trying to keep positivity in my life. It's always going to be a lot of negativity in the world, but guess what? Me and Mel was just talking about, we're going to take the negativity and we're going to turn that into positive energy, because ain't nothing going to bring us down. Nobody can judge us. So, you know what I mean? Like, everything's going great right now. Like, I mean, I couldn't be happier. I woke up, you know, I'm getting a little better with my habit. I'm bringing it down a lot. I'm trying to get to the point. I'm almost there to where I want sobriety again. As I told y'all before, I was sober for 8 years on methadone maintenance, and if y'all want to judge that I was on methadone and say I wasn't sober, then that's your opinion, and y'all feel free for that. But I know for me, it kept me off Kensington Avenue, and it kept a needle out of my arm. So, I mean, if that's what it's gonna take, I don't know. But I know I'm exploring my options right now. And with the help of y'all, with the help of Malcolm, and everybody like that does this charity work and supports us addicts and supports Malcolm to support us. You know what I mean? Like, thank y'all. I just want to say thank you. And like, we just gonna keep on climbing to the top till we make it.
Hey, you hear that, guys? That's awesome hearing Darlene speak such positive words. What do you got to say to all your supporters who have been rooting for you, Darlene?
Oh man, like, honestly, y'all like really are most of the reason I got to where I'm at right now. Like, because hearing all them positive like comments, and you know, people know like what I was before addiction, like that really touches my heart. Like, and I do want to be back there, and eventually I will. But I want to thank everybody for helping, and I just want to let y'all know I'm still here and I'm hanging on tough.
Amen, guys. Amen to that. We want to keep our girl.
And I love Malcolm. I love you, baby. Thank you for everything. Thank you.
You already know. God bless the AML family for all their support, lifting our brothers and sisters up instead of putting them down. Because when you lift people up, what happened? They you know,
succeed.
They succeed, absolutely. And when you put them down, what happened? They just keep running and go further into the black hole.
And everybody's not on the same page, so somebody could be so weak, and just one negative comment can really hurt them.
Right.
You know? And you might not ever see them again after that. Who knows? You know, so let's just keep it positive, y'all. And I want to thank everybody for the donations, helping my brothers and sisters. Like, words can't express how grateful I am, you know. And it's not enabling, it's called having a heart and helping.
Amen. It's called compassion, guys. And a lot of people need to learn compassion. If you don't have it, learn it. That's why we do these videos, to educate people on compassion. Just like how you got to learn how to read in school, learn how to write, you got to learn compassion. Because some people grew up in a home.
Addiction.
Yeah, they grew up in a home where they didn't have no love. How you guys doing? So we have, you know, have to be our brothers and sisters keepers.
Exactly.
Treat people how you would want to be treated, right?
Exactly.
Because what they said, what you're judging, you might become one day.
Exactly.
How you doing, dear? So, darling, it's really great, you know, hearing from you.
You know I love seeing you. Thank you for the water ice, Malcolm. We got a water ice from Emerald and Lehigh. Shout out.
See the love? See the love that our brothers and sisters in this dark hole got. And Darlene is such a light in the dark hole, and she's shining bright.
Oh,
that's hard out here to see people, you know, with that, you know.
Gotta take that negativity, turn it into positivity, because you know what? It takes too much energy to be negative. We woke up, we here. No matter what our situation is, always gonna be someone that got it worse, always gonna be someone that got it better. But guess what? You got your own spot.
Absolutely.
And live it.
So what's 24 hours look like for you now, darling? A day in your life?
A day in my life, I chilled a lot. Like I told y'all the last time I seen y'all, I did get an apartment through Pathways, through housing. They are, in my life, they are one of the biggest blessings I've ever had. They will do God knows what for me. They will do anything just to help. Just like, you know, they another one of my supports. Like Malcolm, I got Pathways. this is why I feel like I'm getting to the point where I want to get myself together, because I got so much support right now. I'm not alone anymore.
Absolutely
You know?
not. You're not alone, girl. You have an army of people behind you, and once
Yeah.
you decide to, go for it, and you start taking the steps, we'll be right behind you, pushing you.
And I know you will.
Yeah, because we believe in you. We know that you can,
There's been
break
plenty
through.
of times I was out here hungry. I see Malcolm. Darlene, what's wrong? Oh, my stomach hurts. I'm hungry. All right, come on, let's go get something to eat. You know what I mean?
Yeah,
Like,
keep it 100. So
Yes.
now, darling, it's a lot of our brothers and sisters who are dying out here. Have you have anything like horrible has happened to you, or have you seen anything horrible out here happen recently
man,
to
I've
anyone?
been seeing a lot of people from shooting the coke. They've been having a lot of seizures from that bath salt stuff, and it's scary. Like, seeing that is really scary.
So sorry for cutting you off. So when
No.
people be going, when you see a person like running up and down the street frantically, what type of drug are they on?
Oh man, most of the time it's bath salt. A couple years ago, I could say they were smoking K2 or whatever, but now they
Bath
say it's
salt.
powder, but it's bath salt. And
Well, what is it like? You snort it or shoot it,
they shoot it.
and that's what make people like.
They shoot it with, with their fentanyl.
Oh, okay.
Yeah, and man, I've seen seizures that look like they were near stroke, like stroking.
And that's from
And
the
that's
bath
just,
salt.
yeah, that it's so scary.
And so I'm glad you have gone down on your
Absolutely.
your use.
Cause now I'm in my
rooting for
apartment by myself most of the time, so God forbid if I used and nobody's there to help me if anything
you.
happens.
Right. There's a number that I have to give you. It say you can call that number if you're alone using, and they'll stay on the phone with you until you're done.
Oh, that's awesome! I didn't
Yeah.
know they had that. That's awesome.
Got to get that number for you. Okay, so darling, we about to wrap things up.
Yes.
We're just doing this little quick update for your supporters.
It's always a pleasure.
We're happy you're alive and that you're,
Yes.
you got hope. That's the most important thing to have out here. Now, do you have any abscesses or wounds that you think, we need to know about? Because there's so many bad ones out here, and a girl, Michelle, died recently from
Yeah.
one. So many of our.
Yeah, I know.
But if you have any, I got some ointment in here.
So
you can go
that's
through there
another thing.
and take what you need.
Okay, that's another thing that everybody needs to educate themselves on. Is a lot of, I guess they're calling it crocodile. It's from the trank in the fentanyl, and it's eating people's skin. Like, they're getting limbs cut off, and they're getting abscess. And right now I'm suffering from an abscess, a major one on my leg.
That's
and
enough to show us.
look, you see my leg is so swollen, and it's just, I got it wrapped up with, but I just did this. By tonight, my whole sock will be soaked with pus.
So what was the situation with the hospital? Because
That's my fault.
yeah, we have to.
I have to go.
When you want to go, darling, we can go right now, girl. Because
I know, and that's the thing, Pathways too, they have a medical clinic, and they're like, come on, we'll come get you. And I'll make an appointment with them, and I won't be home when they come. Like, and it's kind of like, I'll act like it's not purposely, but in the back of my mind, it really is.
we have, because darling, I talked to a girl, her name is Michelle, and I interviewed her, and she showed me her arm, and you
I
can
know
see like
Michelle
the
very
whole,
well.
Yeah, she died, and
And she was such a good girl.
yeah, such a sweetheart. She didn't deserve that, but she had a really bad abscess on her arm, and you could see like it was like really severe.
Tendons and everything, I know.
Yeah,
Did she show it?
Yeah, she showed it. And she didn't go to the hospital, and I was trying to tell her, let's go to the hospital, but
She was a dog.
time ran out. So, if it's
I know.
serious for you like that, love, I don't mind meeting you a day, and we can go together. If you need support, we'll be there for you. because I just don't want to lose you.
I know.
We have lost
know.
13 people from the channel, girl.
Oh my God, it's
Yeah.
13 already.
Yeah, 13. Either the drugs or the lifestyle. You heard what happened to Jessica and Jason at the train station when the car came and ran into them. Jessica and Jason
then a couple people just fell on the tracks.
on the tracks. And then look what happened to Bree. She got set on fire in Tioga Park.
I know. Is she alive?
Yeah, she's alive.
Is she okay?
Well, she don't have her face anymore.
What?
Yeah, she will never have her face. Her face is gone.
No.
Yeah, but when we heard about that, we got the story on the news. We made it go viral, and her GoFundMe is at $43,000 right now for her mom.
But did they find the people?
They said that
It's crazy because a couple weeks ago I was sitting on like the metal things at Tioga Park.
Yeah.
And it was like 10, 11 o'clock at night. And I just heard, thank God my hearing's good. I heard footsteps running. I turned around, 2 young boys right behind me. They were getting ready to grab me from behind.
God.
I jumped so fast, ran into the street. They almost had me.
Thank God, yeah. So it's dangerous out here. And unfortunately, you know, they did that to Bree. Penn State graduate and everything, and now her face is gone. She's home with her mom right now healing, but you know, it's like,
Oh my, have you seen her?
I haven't seen her yet. Yeah, but you know, it's a tough situation. So that's the type of stuff that goes on out here.
Damn, yeah, listen, and there's a serial rapist going around. A couple girls got severely beaten. And this was a couple weeks ago. I don't know if the guy is still around, but it's just so much going on out here.
Yeah.
It's not even worth being out here anymore.
And that's why people have to speak up, because when we speak up, we stop some of these things from happening. A lot of these guys are starting to get caught now. Like a lot of these rapists, one got caught, he drive a Dodge Charger.
Yeah, that guy.
Yeah,
He got caught?
Yeah,
I heard he did.
Yeah, he got caught.
He was severely beating the women.
There was another guy named Malcolm out here raping women from New York. He was from New York, and
I
they tried
think
to
I
frame
heard
me.
of him.
They tried to frame that guy
I
with me.
think I heard of that, Malcolm.
Yeah, his name was Malcolm, but thank God he got caught.
Yeah, someone did say that he was a rapist. I
Yeah.
was cracking up.
They tried to get me linked up with a rapist from New York named Malcolm.
They
tried to-
love you, Malcolm.
I was like, for real? And thank God he got caught. The Malcolm, the rapist of Kensington, got caught.
That's crazy.
Right, that's crazy, right?
But it's always going to be another one.
Always. Yeah, it's still
why you
more
gotta-
out here.
yeah.
So guys, we about to wrap up this update with the lovely Darlene. I want to tell her thank you so much. We're going to stay
You're
connected with her.
welcome. Anything for you, Mel.
You got it, love. We're going to stay connected with her. And, you know, AML family, drop all the positive comments you got for our girl and keep her in your prayers.
Yeah, I need that positivity, y'all.
All right. So remember, guys,
Support.
don't be bitter, be better.
Yeah, I know that's right. I like that.
Until next time, AML Films, and we out there.
Yeah.
Peace out.
really, we wanted to definitely demonstrate, someone who obviously, and you can go back and see some of her earlier videos, but someone who is definitely talking about how she's trying to reduce her use. She is in a housing program. The housing program appears to understand the harm reduction model. They're not expecting her to be perfect and not use. They're providing medical supports if she wants those medical supports. And, you know, you can see her ambivalence about going through with those medical supports. So there's a lot of definitely, you know, challenging aspects to the people that are afflicted with alcoholism and substance use disorder. So the most we can do is provide the best harm reduction model that we can. So I'm going to, did you want to add anything?
No, I just wanted to say that during my 10 years at Babylon, I had a Darlene. It wasn't Darlene, but with many of our conversations, I genuinely started to care for her. And it's been years, and watching this, it reminds me of some of the deeper conversations that we had, where she was lucid and made sense, and I could understand where she was coming from. And in regards to like harm reduction, I know that many times we have a curfew with the residences. You gotta be in by 11. For many of my guys, party didn't start until 12. So they knew, and they felt comfortable enough that if they were not coming in by curfew, they were gonna call, so that I knew where they were, at least a general idea. I had heard from them at whatever hour in the middle of the night it was. And that's just a step, because you know what? Now I've developed communication, I've developed trust with them. So yeah, all right, you know what? You're not gonna make it home tonight, but okay, I did hear from you. So that demonstrated some responsibility on your part. Well, look at you. At least now you're calling me. And we'll start it from there. Because it doesn't happen overnight. And unfortunately, the end is usually tragic. Just, you know, be patient and just do the best you can. Nobody's looking for a miracle, because every time I left the residence, I would say to myself, by the grace of God, there goes I. Because who's to say that that couldn't be any one of us, or a sister, a boyfriend, an aunt, uncle, girlfriend, close friend. So we're the blessed ones. We are the fortunate ones. So our job is to, you know, to continue to help the less fortunate.
I'm just gonna turn this off. Hold on. Stop recording. Yes, thank you, Ivan.